Hi, I'm Tim Williams. I'm the lead litigation attorney here at the firm. In this video segment, I'd like to talk about posterior cruciate ligament, or PCL damage. That's a ligament in the knee that is oftentimes injured when the lower leg itself is impacted. Here in this diagram, we have an image of the knee itself. This is the front of the knee, what we're looking at now. And what we can do is we can take some of the tissue away, the muscles, the ligaments, some of the tendons, nerves, and whatnot, and get down to the bony structure of the knee itself with the four main ligaments that are shown here, as well as a couple of additional structures. Now this is the front of the knee. You can see the kneecap there on the screen. The PCL, P means is short for posterior, and posterior means the rear of the knee. So what we're going to do is we're going to flip this knee around and look at the back. And now we're looking at the back side of the knee into the knee space, or the joint space itself. And you can see this tendon here. That is the posterior collateral ligament, or excuse me, posterior cruciate ligament, or PCL. And to understand the purpose of the PCL and how it might be injured, we have a short video we can watch. So again, we're looking at the knee here. We take away some of the structures, and we can see they're highlighted the PCL, which is what I just showed you. That's the lighter structure there. And as one bends their knee back, so you're now flexing your knee, this is the lower portion of the leg going up, you can see it becomes slack. As you put your knee back straight, it becomes taut, and it keeps the knee from hyperextending. And the problem we have is if there is pressure, as you just saw applied to the bottom portion of the leg, it pushes the entire structure back, and it's already tight or taut when you're standing up straight, and you add that additional pressure, that's what can cause the damage to the PCL tendon itself. PCL injuries are relatively rare. Usually it's the ACL, the anterior ligament, that's injured and the one that needs to be operated upon. When a PCL injury does occur, however, let's go back to the back of the knee. What happens is you can, here we go. You can damage, have a tear of either the middle portion, as we see there, or you can tear the upper portion, literally tear it off the bone, or tear a portion of the bone away with it. Or sometimes you can tear the lower portion, where it's tearing that lower portion off the bone, or sometimes pulling a piece of bone with it. They're painful, obviously. Is not quite as important structure as the ACL. Sometimes if you have a PCL injury, a partial or total tear, the doctors will advise you, of course, but you may opt not to perform surgery on it because it, again, is not as significant a structure as the ACL is, for example. But that being said, oftentimes the doctors will will perform surgery on it and do a reconstruction of that ligament.
If you've been injured and need help, Dwyer Williams Cherkoss attorneys will get you the settlement you deserve. Experience gets results.